I'm on my first little break. I'm gonna eat one of these Perfect bars. I'm obsessed with these, but I wanted to share a quick story about my needle stick that I got. This was years ago. I've only had it happen to me one time, but it was absolutely terrifying and like the worst couple hours of my life waiting for the patient's results to come back at whether like they had HIV or anything like that. So I'm gonna share what happened and why it happened and tell you what you can do to prevent it from happening to you. So I was using an insulin syringe. I was giving my patient insulin and I was grabbing their skin with my non-dominant hand and I gave the injection. And when I pulled the injection out, I went to slide up the safety on the needle. But what I did, instead of using my hand that I gave the injection with, I took my non-dominant hand, and as I was pulling the needle out and coming to slide the safety up, I nicked my finger. I was just going too quickly. I nicked my finger, and I was wearing gloves and all that, but I still like poked through the glove and I drew blood on myself. I washed my hands and I was absolutely terrified. I went to the charge nurse, told her, we went through all the steps and protocols as far as testing the patient. Luckily they were negative for everything, but it was very scary. And so what I was doing is, one, I was just moving too quickly. And two, this is the biggest thing I teach this to all my students and everybody, is when you're giving an injection, don't use your opposite hand to slide your safety up. Use the hand that you gave your injection with to slide up that safety on the needle. This prevents you from hitting yourself like I did and just minimizes that step. So give your injection, pull it out, slide up with that same hand, and you'll be good to go. If you do get a needle stick, I know you can maybe feel guilty or ashamed or embarrassed, but don't. It happens. You need to protect yourself. So make sure you talk to your charge nurse, go through all the necessary steps as far as getting the patient tested, getting you tested, following up with occupational health or whatever your protocol is, because you need to keep yourself safe. But first and foremost, let's try not to get a needle stick. It happens sometimes, it's scary, and let's just try to prevent it.